Live is Governor Larry Hogan. He's declared a state of emergency in Maryland. Governor, thank you so much for being here.
Good morning.
Obviously, coronavirus on the minds of a lot of people here. On a federal level, we're hearing reports that there's a shortage of these testing kits. So in the state of Maryland, what are you experiencing? If someone needs to be tested for coronavirus, they think they might have the symptoms, can they be tested?
Well, here's the good news. On Tuesday of last week, Maryland was approved by the CDC to be able to do our own testing, which most states had not been. Up until Tuesday, we were waiting almost up to a week to get test results back, and now we're doing them in Maryland. We had plenty of tests as of last week, and this week we're going to double the number of tests that we have available. So currently we're okay. But as this thing continues to escalate and there becomes more and more demand for testing, it's something that we're obviously concerned about and staying in close communication with the CDC on. They're ramping up production of these test kits so that we make sure that we don't run into shortages, not only in Maryland but in other states across the country.
The 3 people who have been confirmed are all in Montgomery County. Are you expecting more cases to be confirmed in the state?
Well, I guess the best way to put it is that we're hoping for the best, but preparing for the worst. Sure. And we're, because of the exposures and the things are happening so rapidly that we expect that potentially there will be more cases. We've tested 52 people. Luckily, we've only had these 3 positive tests. The rest of them up until this point are all negative. Okay. But we do test every single day. Mm-hmm. We'll have more results later this afternoon. And we'll continue to do it. These, as you know, just as you just mentioned, they just popped up. Ours were Friday. Mm-hmm. Then we had Virginia and D.C., 2 cases just since then. So we're taking it on an ongoing basis. People should just continue to be vigilant. I just want to stress it really affects particularly older people. Mm-hmm. I think the average age of people contracting the disease is 60, and the average age of the deaths is 80. So it affects older people, which is why we're particularly concerned about the one case where the person was exposed at a nursing home facility. And so we're keeping an eye on our state health department team has been working seamlessly with the local health departments. Our emergency management teams are engaged with all the local folks and with the federal level. And we declared a state of emergency, and we're staying on top of it as best we can. We're trying to just make people, they should remain calm, but stay informed, watch your news program, keep up to date on the latest information, and we're going to do everything we can to keep the people safe.
Mm-hmm. Okay. And so, I was just going to ask, that's kind of, what's on the minds of people. If I have an elderly relative, if I'm elderly, should I stay inside? There's a state of emergency. It certainly seems that there's urgency here.
Well, I think the information that came out from Dr. Fauci this morning on NBC just this morning said that elderly people should try to should consider limiting going to large public events with lots of people, should consider not going on cruises, and maybe if they didn't have to, not take trips on airplanes. They don't need to be worried that they can't leave their homes, but just keep an eye on older people and people that have serious health issues that are most vulnerable.
And you guys aren't planning on shutting anything down at this point in time?
At this point in time, we're not making those decisions, but as the facts change on the ground, we'll be making decisions on a case-by-case basis.
And last question, we're out of time, but are you happy with the administration's response to this? Is there anything else that they could be doing to help you guys out?
Look, I think so far it's been really good. We've been meeting with the White House team, with the HHS, CDC. The federal, state, and local response has been really good. I think it's a great team of people, professionals, working really hard to try to keep people safe.
All right.
Governor Larry Hogan, thank you so much for joining us.